So my name is Melissa Nagare. I am a chiropractor and licensed acupuncturist and currently serve as the Chief Clinical Officer at Southern California University of Health Sciences, which is the home of Los Angeles College of Chiropractic. And I'm here today with my L.A.C. classmate, Dr. Eric St. Pierre, DACBSP. So Eric is currently in private practice in Lafayette, Colorado, which I just learned is very close to Boulder. And in 2010, Eric served on the USA Olympic medical team, primarily working with speed skating for the Vancouver Olympic Games. And in 2014, Eric was again part of the USA Olympic medical team, this time at the Sochi Winter Olympic Games. And we're here doing this interview today because a couple weeks ago, Eric had texted me a link to a video he created about his Olympic memories. And I really enjoyed watching the video, and I thought it would be fun if we could talk a little bit about that. So thanks for agreeing, Eric.
My pleasure. Thanks for having me.
No, I'm happy to do it. So in the video, actually, you start off talking about your childhood and where you grew up. So do you think your love for sports contributed to your decision to become a chiropractor?
Sports meant so much where I grew up, back east, the Northeast, and I think a lot of people all around the country can feel that way, whether they played sports or not, they're a fan. But it didn't really, my injury, I shattered my femur my senior year of high school playing hockey, and I had to go through physical therapy, so I knew I liked rehab. But my dad had, once he hurt his back and his hip, I had a skateboard and it was on an incline or a hill, and he doesn't ride a skateboard, and he's like, let me try it, and stepped on it, and the classic fall, hit himself, and he went to a chiropractor who, performed some traditional stuff, but ever since I was little, he was like, oh, you should be a chiropractor. You should be a chiropractor. And I knew I wanted sports medicine. And I think I was 17 with my guidance counselor in high school, and they did the whole evaluation of who you are and what you're interested in. And chiropractic came up, and, you have a lot of interest in where you grow up tends to influence you more than you realize. Later, I realized my dad was chirping in my ear about being a chiropractor, and it played out that way. So
that's awesome. I don't remember. Yeah. I definitely remember you telling about your broken femur. What I remember you saying about it is that you were on the ice and your skate was here next to your head, but and it wasn't because you were flexing at the hip. It was
yeah, and that just woke me up. It is the best thing because I had tightness and stiffness, and going into, undergrad, and I moved to Florida, to South Florida, and worked for physical therapists for 3 years with a sports performance place. So I wanted to be a chiro. And when I finally got to SCU, literally my experiences with the Chinese medicine side, the acupuncturists, them being like, why don't you cup it? Why don't you scrape on it, do gua sha, encouraging me to use it in a contemporary fashion. And in the end, if I didn't break my leg, I would have had no idea what they were talking about.
That's quite a gratitude practice right there.
Yeah.
Feeling appreciative of something that, really, it was terrible what happened to you, but seeing the bright side. I think in our time, a lot of SCU's emphasis was on this sort of idea of the dual degrees. Mm-hmm. But now it's really shifted, and it's gone to interprofessional education, where we have the chiropractic, Doctor of Acupuncture and Chinese Medicine, and Masters of Physician Assistant students mm-hmm. sitting in the core classes together because, biochemistry is biochemistry, and they all need to know it, and anatomy is anatomy. So they share all of those core courses so that they can learn from within about each other, which is something that has evolved since our time there.
Having both programs in a class, just to realize how valuable they are, that's awesome.
One of the things I wanted to ask you about, and I think we touched on it a little, but what were some of the reasons why you decided to attend SCU, especially because you were coming from the East Coast?
I decided on SCU for various reasons, but mainly just the education level, the perspective. I wanted medical foundations. I wanted like evidence-based, and they had a long history, which was really cool. I didn't realize later how deep it was, how many other schools were part of that. And then I didn't realize what on the West Coast, to me, the chiropractor is a little different, you know, like the mentors and the people involved in our education. It's a different attitude, you know.
In what way?
Just more progressive, more open, don't box them into a corner. Like this is a chiropractor, for instance, and just from medicine, sports medicine, they were demanding on themselves and very accountable. And it's not that the East Coast isn't that, but it vibed with what I felt and turned out to be a really good decision.
There was something that you said in the video that you made.
About knowing, not being prepared.
Yeah, because it's a very common theme that we see with students, and especially clinical students. So if any of those students watch, then I thought they might like to see what you have to say. But what I did was I put some clips from your video into a PowerPoint so that we could watch them, and I could play them and then ask you. Let me share that.
Into the short track team, because in 2010 we were riddled with injuries. My first 2 weeks on the job, we went to Olympic trials. A lot of pressure. I don't really know what I'm doing. I took over. I come in. We head up to Marquette, Michigan, and J.R. L.Ac, one of our most talented skaters ever, crashes and essentially cuts off his leg. And I've ruined my body on the ice, blowing up my leg. The worst pain was not breaking my leg. It was the guy pulling my leg. Essentially torture, but with love. And I watched JR bleeding out on the ice.
So, spoiler alert, JR came back. So, but can you talk a little bit about like sort of that moment, and then, those kind of like normal self-doubts that, providers can have?
Yeah, I think, the people who will be successful are the ones who realize they have to acknowledge what they don't know. And, I was as prepared as possible, even being hurt on the ice. Like I was ready to be there for him, realizing like, okay, once the wound is covered up and they're managing the bleed, there's a lot of traumatic things he's going through, and being there with him after. And even though I had been exposed to so many unique experiences on the sideline with sport, with the residency, and in my own life, it turns out like you're not supposed to know everything. Just do your best. And if you need help, ask for it.
For those students out there who are interested in becoming sports chiropractors, and those, who have aspirations of treating Olympic athletes, what advice would you give to them?
Just make sure that's who you really want to treat. We see a lot of athletes that want to be sports chiros, and then they only want to work with athletes. If you want to work with athletes, their life and their work is their sport. So just realize it might not be all about athletes. Sports chiropractic applies to most people because you just have to be realistic. What's their sport, Mm-hmm. If they're a firefighter or they stand or sit all day, that's what it is. So just let's see how well you know your physiology.
So understanding that your practice, for sports chiropractors, your practice is likely not going to be 100% athletes.
No, not at all.
Now, I understand for, healthcare providers can apply for 2-week rotations at one of the U.S. Olympic and Paralympic training centers.
Yeah.
As a chiropractor, do you have to have the American Chiropractic Board of Sports Physicians? Do you have to have the CCSP, or do you have to have the
you have to have, from what I understand, is you have to have the CCSP.
Which is the first level. Yeah,
and that is sufficient for a lot of people. The diplomate is just a deeper investment if you really want to treat athletes, and anyone can treat sports injuries. It's just how well do you want to manage athletes or teams or coaches? You have to be a leader, and the diplomate is essential, but you need from what I understand, the CCSP to do a 2-week rotation at the United States Olympic Training Center.
Like what are your thoughts about the work ethic that's required if you want to be a sports chiro.
Yeah, you're self-driven. You don't need anyone to motivate you. Even if it's fear, you need to be driven. You know, I didn't want to fail half the time, so I was just trying to be as prepared as possible. But you know, you're not working for yourself. It's the classic. You know, the Olympic spirit is everyone, even the countries all work together, you know, to support each other. But Team USA is such a proud thing to be a part of. And if you're a sports chiro, you're doing the right thing for the patient, you know, and that should be the standard for any chiro, but especially in sports medicine, because they're also looking for performance. And so they're relying on you to have vision and be well-rounded and not just be a chiropractor. You know, you're a hybrid. And, you know, our school totally prepares you for it. Now when I go with patients to their surgeries, if I know they've been struggling, they don't have anyone, I'm like, I'll go with you. And that's a work ethic that I don't think most people would do. You know?
You touched on another topic too that's sort of a motto in the SCU health system, which is that the providers are here to drive the best to the destination for the patient. Meaning, like you said, if that means going with them to their surgery, like that, you know, I think that's a really, you know, that's maybe more of an extreme example, but sometimes that's what needs to be done. Like if you're requesting an authorization for an MRI, don't just request it and forget about it. Follow up in a day if you haven't heard back on the status of it. Like, make sure that comes through. And
Yep.
then, you know, it's helping them to each step. Don't let anyone just fall into some kind of black hole where, you know, they're lost to follow up.
Yeah, and it's pretty natural to help people. You know, I work with an osteopath. He's my partner here. He is so diligent in taking care of his patients more than, you know, it's not about criticism of other professions, but it was so surprising and refreshing. And, you know, he'll go to visits with patients that are really suffering.
So I had taken this screenshot just because at one point I was watching and I was then looking around like in this room and I was like, oh, he has a squat rack. Maybe
Yeah.
that's an Olympic lifting platform. And I see a snowboard and I see snowshoes and a skateboard and a bicycle. Then I was thinking about my garage and I'm like, yep, I have a road bike, I have my snowboard, I have a skateboard, I have a surfboard, I have tennis rackets. And then when I think about, you know, the SCU campus, you know, we have now students who set up slack lines in the Glen. There's always a group that plays soccer, people throwing frisbees. What do you think it is about the chiropractic profession and its appeal to people that are just so naturally active?
I think it's a lifestyle. You know, chiropractic in general is just someone who's invested in, you know, improving their lifestyle, learning about managing their lifestyle and distributing that information to people. And in our school, it's great weather and the West Coast is so chill relative that people are just outside and it's something to be proud of.
So I think you're totally right about the lifestyle. I mean, sometimes I sit here and I think, like, I'm so lucky that it's part of my job to research, like, you know, what are the most up-to-date evidence-based nutritional guidelines, or like what are some things, you know, what are relaxation practices that's like, wow, I'm getting paid to do this, which benefits like myself and my family, and I get to live it every day, walk the walk.
Yeah.
It's really cool. So in the video, you know, the theme of the video is your favorite Olympic memories. You talk about USA bobsled breaking the 62-year drought, about Apollo Ono, Shawnee Davis, Eric Biden, the 2010 Olympic short track team, Stanley Cup, like all the hockey players you've met over the years. Can you narrow it down to your top one favorite memory?
It's not one of those. You know, there's a lot of memories, and you know, some of them they're about athletes. So, you know, try not to put too much attention on like who have I met, but my family and friends like hearing about those things, and my patients ask about. So I put it out there, but my favorite is just simply being in the sports med training room, which is a high-end condo, the big living room. It's not finished, and it'll be finished once the Olympics are over and someone purchases it. But just being in this makeshift training room with massage tables and all your items, and being with the staff and the athletes, and the spotlight's not on us, but being there, that we've done everything we can to support the athletes so they have the best chance. I think that's my favorite memory, is just those moments where you're like sitting there and, I can't believe I'm here. It has nothing to do with medals or recognition, but just being really appreciative of it, because I can talk about these medals, but you never get those moments back.
It's funny because when you were talking about, that feeling of being in the sports med training room, and, kind of like those, I don't know I know exactly what you're talking about, but it's hard for me to find the words to describe it. But I found my mind going back to my time as a student at SCU, which just sounds like your mind was going to that same place, because, and it's not just like one thing that ever happened over the course of our education, but just sort of this like feeling of knowing what we went through all together. And
yeah, when I think back to it, I couldn't wait to be done with school. I was over studying. I was over listening. I just wanted to start doing. But it was appropriate to be in the clinic, having guidance in those moments. I miss being there with everyone and thinking about that. And I don't think about it that much, but when you think about the things that mean the most to you, like that helped develop me and define me and refine me. So,
I think that's really what it is for me too. Like the thing that I was having a hard time finding the words for is almost the memory of the relationships and how those felt at those times, whether it was in our first year when we were just doing so much studying and, memorizing things that were a little bit disconnected. And then in the second year, it was like, oh my gosh, like now I understand how these fit together.
Yeah.
And then in the third year, being in the clinic, being with Dr. Meyer, who is still with SCU.
Awesome.
So I loved our clinic family.
It's the same feeling when you're first starting. Like, I'm like, oh man, I don't know. But you just try as hard as you can. And you have people around you that will support you. And
this has been so much fun, Eric.
Yeah.
Thank you so much.
Yeah. Thanks for having me.